When we meet somebody for the first time, the smile says it all. If somebody has poor teeth or great teeth, we treat those folks differently. I think it has a lot to do with how we perceive ourselves. If we have healthy, strong teeth, we feel healthier and stronger. If we feel healthier and stronger, we tend to act as such. If our smiles are poor or very poorly maintained or even missing a teeth, we tend to try to hide that from people. And then we become more withdrawn, and then people don't trust us as much, don't like us as much. You know, they think we got something to hide, which actually is true. A lot of people think that is normal, so in their lives at least, to have teeth in the condition they're in. And quite often they're not even aware of the things we can do in dentistry these days. Patients come in to get certain things done, and it could be as simple as a cleaning, or it could be as involved as multiple implants or braces or crowns and what's aesthetic work. But they always seem to be leaving happier and more satisfied than when they came in. And to see the kind of result and see how that indirectly influences people's lives is very rewarding. It's important to know the person that you're dealing with. You know, the teeth are important too, that's what they're there for. But if I don't know the person, I cannot possibly do a good job for them. The patients need to trust me. They need to have confidence that I can deliver what it is that they want. Now, for them to trust me, I got to get to know them. I got to find out what exactly is what they're looking for. I need to know about barriers that might have prevented them from doing so in the past. That might have been finances, that might have been fear, that might have been time, maybe they were out of town or out of country for all kinds of reasons. I cannot just look somebody in the eye and in about 3 seconds tell them what they need to do. Nobody wants to be told anything. You know, we like to make our own decisions. I'm no different. I like to make my own decisions too. By getting to know my patients and by really understanding what it is that's important to them, then it's easy. You know, then you just have to find a way how to do it. And I find that works quite well. When we have, let's say, a new patient in our office or even an existing patient, sometimes their needs are quite complex, or sometimes communication doesn't work as well because while I'm talking to them, they think about something else, you know? And they don't want to appear to be ignorant or not understanding what I'm talking about, so they will nod and say yes and smile at me, giving me the impression that what I'm trying to get across has actually gotten across. They leave the office confused. And that always bothered me. I always thought there's got to be a better way to deal with that. What we do in our office for the last probably 15, 20 years or so, what we're doing is for the more complex cases, we do a customized written report which states what's going on in the mouth, how it got there, what the options are, what is elective, what is more like urgent, how long it's going to take, and how much it's going to cost approximately. So then they can take that home, read it over, and then usually they come back maybe a second time, sometimes even a third time, to ask more questions. People have the tools to decide, and then typically they would go ahead. And sometimes it might take 3-4 years when we hand out one of those reports to our patients. Then they come back and they say, hey, I'm ready now, let's do it.